Well, good Monday morning. Certainly appreciate you being here. We're back at the Civic Center. It's not basketball, it's not concerts, it's all about vaccines and what's happened over the last couple of weeks as far as what the partnership with the City of Mobile and USA Health and what's been able to be accomplished. Well, the last time we were here, we were actually only doing about 150 vaccinations a day. The next goal was to get to 250. Last week, they achieved a level of 500. This week, the target is 800, and then trying to get to 1,000. It's very important. You'll hear it in a few moments from Dr. Chang, the Chief Medical Officer at South Alabama, as well as Natalie Fox, who coordinates all this for USA Health. But what's happening is that as the efficiency increases here, the state of Alabama is sending more vaccines to USA Health in order to increase the total number of people in this geographical area to get the vaccines. So we're very fortunate that the state recognizes, because of the efficiency here, that it's worthy of getting more vaccinations. I would hope that Dr. Chang in his remarks would talk about which vaccination it is that you get here. But it's a very seamless process once you get in the queue to get your vaccination. And the focus now is on what we refer to as the 1C allocation. And you can go on a website, a USA Health website, and probably determine whether you fall into that category. I was fortunate enough to get a vaccination recently. I've already been online to schedule my second vaccination of the booster. And so for those that have the ability to go online, to get in the queue, it's very important to follow that registration process, because that allows us to get more people vaccinated, over a shorter period of time. I would say this, though, that today there's a little bit of congestion outside, because as we've ramped up from the 500 trying to go to 800, and because also people are hearing that, you need to get there early, or you need to get there at such and such time, maybe in order to get kind of ahead of the game, or they work you in. There really isn't much working your way in ahead of anybody now, so please don't show up until the designated time that you're to be vaccinated, and it helps the entire process. So having said that, I'll turn it over to Dr. Chang, the Chief Medical Officer for USA Health. Dr. Chang.
Thank you, Mayor Stimpson. Good morning. On behalf of USA Health, I'd just like to make a few general statements and then talk a little bit about, again, the importance of vaccination and how important it is for all of us to take advantage of the opportunities we have in our community to get the vaccine. First of all, we're excited to be part of all this with the City of Mobile. We're just walking through the setup here, both on the vaccination side here and the testing site on the other side of the building. Is just a fantastic operation, and we really appreciate the city's helping and coordinating with us to be able to provide this service to our community. In terms of vaccine and the vaccine itself and why it's important to get, let me just bring a couple of things to light. Number one, we've got a long ways to go in terms of getting the percentage of the population in our community, in our region, and across the country to a point where it will be safe to begin to really start to move towards some semblance of the life we knew before the COVID pandemic hit. We don't know when that's going to be, but this is an absolutely important step in doing so. Now, in addition, you've heard in the news probably about variants or mutated strains of the COVID-19 virus being identified. There's a variant out of the United Kingdom or England. There's a variant out of Brazil. There's a variant out of South Africa now. And we don't know a lot about these, but so far what we do know is that they seem to be about 50% more likely to give someone that's exposed an infection than the original variant did. That means, what that means in our terms is that transmissibility is up, and that further accentuates the pressure on all around the world, especially and in our community, to get as many people vaccinated as quickly as possible. Because even if the new variants don't make you sicker, If it increases the number of people getting sick, that increases by if you just do the math, that increases the odds that more people will become seriously ill. And again, as all of you know from watching the news and both nationally and again in our city and our region, the healthcare system has been markedly taxed or really overburdened by what we have right now. So again, it's important for us to get the vaccine volumes across the country up as high as we can, as quickly as we can. The vaccine is safe. The side effects are generally very well tolerated. And so please, all of you, please come out, get the vaccine, get your first dose, get your second dose. Let's get this thing taken care of. So with that, what I'll do is now turn it over to Natalie Fox, who works with us at USA Health, who's really been the one in charge of the operations for all of what you see here, whether it's on the testing side or the vaccination side. So Natalie?
Thank you, Dr. Chang, and thank you, Mayor Stimpson. So yes, we are excited to be here today, and as you learned from Mayor Stimpson, we are working really hard to increase our efficiency and be able to reach more of those in our community. We really appreciate everybody's patience as we have went up to 800 appointments a day here, and we really are working as hard as we can to move all the traffic through. I also just want to highlight, just like Mayor Stimpson said, please come at your appointment time. We are having a lot of people show up early or show up without appointments, and that definitely decreases our productivity when it slows us down. He mentioned going to the USA Health website, and yes, if you'll just go to USA Health, there's a link to register for vaccine. Anybody can register, whether you are a 22-year-old healthy person, you can tell us about yourself there and go ahead and get in line for when the Alabama Department of Public Health increases those eligibility categories. We are steadily working in those that are currently in the 1A category, which are healthcare workers, first responders, and then we have also moved on to the 75 and older, as we talked about before. And then again, we are anxiously awaiting increasing to the 65 and older and essential workers. If we have availability of appointments, we are of course moving down to that eligibility queue already to try to vaccinate as many people as possible and as fast as possible. Again, I really am thankful for our partnership here with the City of Mobile. It's allowed us to stand up this operation, and we have a great team at USA Health that's pulling all this off. And so again, I think we all just want to get back to hopefully maybe next year, our Mardi Gras season. The Civic Center means so much to so many people, especially around the time of Mardi Gras. And Mardi Gras is definitely part of our culture here, and we are happy to be doing our part to get us back to that. So I'm going to turn it back over to Mayor Stimpson.
So I would have to say that Natalie and her team have done an amazing job. This vaccination site would be equivalent to the drive-through at Chick-fil-A. For vaccinations, this is the Chick-fil-A of vaccinations. So you know the efficiency that they've achieved, and so it's just great to be a part of it. And we'll be glad between the three of us to answer any questions that the media may have. Yep.
How are you going to handle the new eligibility rules? Are you going to wait till February the 8th?
No, my understanding is on the eligibility rules that you're already addressing the 1C.
So we kind of act like an airline industry, right? So the priority boarding comes first, and that would be those that are already been eligible for a vaccine. But then if we have appointment slots available, we are going ahead and booking those that are already registered in our system that meet the 65 and older or any of those other essential categories. We have over 10,000 people who have used that registration site. Our biggest category of people that are sitting in our queue are those over 65. So again, if I have 75-year-olds or healthcare workers or first responders register, we go ahead and put them through first. But if we still have appointments and I have vaccine supply, we are moving on to that next eligible category that's coming.
What are you telling people here today that do not have an appointment?
So unfortunately, you've heard a lot about this vaccine and the cold chain of it, right? There's a lot of cold chain logistics, and so we only have so many vaccines prepared, and it's for the ones we knew we were coming with appointments. And so most of the time we have to turn those away. We understand that can be frustrating, but there's other areas in our community that are doing first come, first serve events, and so if that's your preference, I would suggest to go to one of those. Those have been popping up too around the community.
Subject where?
Sure, so I know that on Friday, Ascension Health did one at Dayspring, and I know Mobile County Health Department has also been announcing pop-up vaccine first come, first serve events.
Any other questions?
Will you stop at 1,000, or are you going to try to go beyond that?
We're going to do 1,000. Once we get to 1,000, we'll decide how to go to the next threshold. But we are, in the back of our mind, having a mass event one Saturday to see if we can't do more than 1,000. But that's just in the talking stage right now.
Is, you know, the folks that come here, they register online, right? Before, you know, some places you go sit in line, then you get a ticket, and you come back on a different day. But all this is handled online only.
Yes, right now that was our most efficient way to get started, was to handle it online only, because we already have so many of those demographic information. Not only when we give you the vaccine, we also have to report to the Alabama Department of Public Health using their Imprint immunization website. And so again, it allows us to gather all that information and to be most efficient in those populations that we're serving.
Is that it? Thank y'all. Appreciate it.
Thank you, Mayor.
Hey, thank y'all.
Thank you, everybody. And just a reminder, you will show like tags or spaces of anybody that you want.
And then she texted me later, said, "Now you have 800. You promised to increase." I was like, "Whoa, whoa, whoa! I told you that. That was fine."